Hello, everyone. Welcome to another day with your fertility specialist. It is always lovely to have you here. I am your host, Joanna Damina, for today. Thank you so much for every sort of encouragement on all of our live shows, your engagements, and just you being with us every other time that we're on live here. We really do appreciate it. We appreciate every like, every click, every comment, and every share. Okay, so if you feel the need to, please share this with someone that you think will be interested in today's topic. We're going to talk a little more about sickle cell disease, and then there are some community concerns that we have on your end that we would want to address today. So if you've had questions about sickle cell and some of our previous topics, including CRISPR, stick around to find out more on this topic and send this to someone that you know would be interested in this because we have a lot for you today. As always, thank you so much for being here with us. Today we are joined by Dr. Ken. How lovely to have you, Dr. Ken.
I'm glad to be here.
Yeah, it's always beautiful to have him here. If you don't know who Dr. Ken is, Dr. Ken is a consultant gynecologist. He is an IVF specialist, and he is also a minimal access surgeon. In fact, the very, perpetrator of, should I say, not like an inventor, but basically starting up some of these things that you would hear of in West Africa, especially in Nigeria. I know we've spoken about hysteroscopy before, we've spoken about a lot of fertility treatments, and yeah, you're looking at one of the very first people to bring that over here to us in Nigeria. Lovely to have you here, sir. So we're
Thanks.
going to talk about, like I said, sickle cell disease and some of our community concerns from the
hmm
people that join us every other time we're on live. They want to know exactly, we see a lot of comments about what exactly is this, what exactly is this. So if you don't mind, tell us more about sickle cell. What exactly is it? And, why does it still remain such a huge public concern for us, especially here in Africa?
Oh yeah, and especially here in
In
Nigeria,
Nigeria too,
because
yes.
in some of the TikTok videos I made,
Mm-hmm.
I talked about TikTok. Talk about sickle cell being endemic to Nigeria. In fact, Nigeria is noted to be the epicenter
Yeah.
of sickle cell in the world. That means we have the load
Of sickle
here.
cell.
It's
Mm-hmm.
like it is distributed from Nigeria.
Yeah.
You understand? It's not infective, it's a genetic abnormality,
Mm-hmm.
that makes the blood of whoever has the abnormality to turn to like a crescent.
Oh,
You know,
okay.
the blood is usually fluid. At best, you describe the shape of the blood like being malleable, like the amoebic shape,
Mm-hmm.
and it moves around and gets into every corner in the bloodstream, in the body, and everywhere.
Yeah.
But when then you have a sickle cell, so the word sickle means the sickle cell means like a sickle, sickle the sickle you use in
That shape.
plucking,
Mm.
in harvesting fruits. So it just turns sickles when you are stressed, when you are ill, or when you are going through some emotional distress and all
Okay.
of that.
Interesting.
And then it plugs the blood vessel and prevents oxygen supply to distant, means some parts of the body. Could be the knees, could be the
Mm.
ankle, could be the joints, sometimes even the eye.
Oh, okay.
So it can cause blindness, sometimes the brain, it
Oh.
can cause stroke, and several other things,
Mm-hmm.
and then the crisis happens. Sometimes the crisis could be in the chest, what we call it acute chest syndrome, when
Mm-hmm.
the individual has difficulty with breathing. Then the blood of these individuals get destroyed so quickly,
Yeah.
as against staying for 120 days that the regular blood stays before
Mm-hmm.
it's renewed. This actually destroys quickly because the membranes are fragile, they are brittle, and they easily get damaged.
Okay.
And so the individuals with sickle cell have a lot of metabolic abnormalities. For
Mm.
instance, handling of this damage, volume of damaged blood, you know, the liver becomes dysfunctional at some point, the
Oh.
spleen becomes dysfunctional to get swollen,
Mm.
and then their blood forming cells becomes too active, the bone marrow, and to the point that sometimes they have a very big forehead, you know, because these are the bones that produce the blood in the
Yeah.
body,
Mm-hmm.
and then their immune systems may be compromised too because of the abnormal hematological processes going on.
Mm.
And worst of all, life expectancy
Wow.
can be very reduced,
Reduced. Then.
you know. And so, and that's just it.
Oh,
And
okay.
all of this happened because of the mutation, an accident of nature,
Hmm.
where a certain protein becomes abnormal, you know, in the DNA of these individuals.
Okay.
Yeah, it's an accident of nature, mutation, and then it can be transferred from one person
Hmm.
to another,
Yeah, we've
and that's just it.
actually had questions about the whole
Mm,
mutation thing. We've
hmm.
had concerns around that.
Yeah.
And, some people don't, should I say, they're not aware
Mm,
that they carry this gene,
hmm.
and they only know that after they've transferred it to their child. I mean, why does that happen? Or should I say, how does that even happen? Because I know we're encouraged a lot
Hmm.
to find out what our genotype is, especially before marriage. You see them hammering on that everywhere you are, from home to church to
Hmm.
everywhere you are. So how
Yeah.
come that still happens?
I think it's actually largely it's actually mistake,
Hmm.
laboratory mistake or errors from the
Okay.
laboratory.
Hmm.
Just last week I was with a client, who all the while thought he was AA, because his wife knew she was AS,
Yeah.
and he felt or thought he was AA because AS and AA are compatible,
Mm-hmm.
because they will not have a sickle
Essence.
cell
Yeah.
baby. So, but for some reason, they have need for doing IVF, assisted reproduction technology, and one of the tests we run is the genotype
Hmm.
testing, because you want to be able to answer every question.
Yeah.
And then when we ran the test, it turned out he was AS.
Oh.
So, and we repeated the test using some other modality. He was AS. We now sent him out to some quality laboratory
Wow.
elsewhere because he doubted. And it was a crisis in the hospital because he
Hmm.
felt we're giving him a wrong result.
Yeah.
Because according to him, before their wedding, the monks requested for this genotype, just as
Mm-hmm.
the church will also request for genotype.
Exactly.
So the result he had and gave to the monks was AA.
Mm-hmm.
So they were deemed compatible, and then they married. But they have some reasons for, to
Yeah.
have an IVF,
Mm-hmm.
and then when we sent him to do another test elsewhere, and then it turned out to be AS.
Yes. Wow.
And apparently now the wife is AS and he's so. In this case, it was quote unquote frank laboratory error.
Arrow. Hmm.
I don't want to
Okay.
talk about who takes responsibility
Yeah.
here. That's not what we're here to talk about.
Mm-hmm. No.
But it was a laboratory error.
Mm-hmm.
But then, even in the laboratory, there are levels of ambiguity that happen sometimes when you're doing this genotype testing,
Okay.
that you need an expert in analysis to differentiate between AS, SS, and AA. Sometimes, especially if you're using the electrophoresis
Mm-hmm.
modality of testing.
Okay.
So, in this case, the plan for IVF changed
Yeah. Had
because now they're
to.
considering whether they are going to continue with their relationship,
Well,
because
that's
exactly,
already.
they're already married.
Yeah.
Now they're really thinking, so we have to suspend IVF,
Mm.
because the kind of IVF that we advise them to do is now the advanced IVF with
Yeah.
pre-implantation genetic diagnosis, where you eliminate the sickle cell
Mm-hmm.
stuff, and no funds
Yeah.
to do those kind of IVF.
They thought you were just coming in for,
For the regular
yeah,
IVF,
regular. Mm-hmm.
but now the genotype has changed the
Yeah.
course of events, So a lot of times is laboratory errors.
Mm.
A lot of times it's laboratory errors.
So
In
would you
that case,
say
it's laboratory. But then I knew that some guys could be very deceptive,
true?
because I've seen some people, yeah, who are desperate to get married to some pretty
Mm-hmm.
ladies, and they don't even care what the implication of their decisions are.
Mm.
They knew they were AS and the lady is AS, but they doctored their results.
That's
Yes,
terrible.
seriously,
That's
they
terrible.
doctored their results to make sure they get married to that lady.
Mm.
You know, They
Oh,
doctor the results. So
that
deception
is,
could be one of those
yeah.
reasons, you know. And then of course these guys got married. One of their kids is AS, you know. I mean it's SS, sorry. One of the kids is SS. And
Mm-hmm.
right now the kid is actually undergoing some kind of advanced medical
Crisis.
care.
Oh, that's really
But out of
terrible.
deception, you know.
Mm-hmm.
So these things happen. So error, laboratory error, deception, and frank ignorance.
Yeah.
And sometimes some people think God or some deity wants them to get married,
Well,
even when
there's
their
that.
genotypes are not compatible.
Mm-hmm.
And to some of us who are clinicians, when you say some gods, we don't doubt your gods,
No,
but
everyone.
it's the results of the outcome that tells us whether your God was right or wrong. Yeah, that's it. So these are some of the reasons. Some is
Mm-hmm.
pure ignorance, and they're lucky not to have fallen into the pits, you know, of having abnormal genotype
Yeah.
mismatch.
I mean, so in cases of people who aren't coming in for IVF, let me say, and don't have to get that genotype testing
Yeah.
done, right? And they may have just thought, oh, one person is AA and the other person is AS. And it turns out that the person who thought they were AA is actually AS. When pregnancy occurs, is there any effect on the outcome of that baby? I mean, should I say the health of the baby, whether or not the baby comes out as a sickle cell carrier?
No, if the baby is not a sickle cell carrier, there's no problem.
Okay.
Yeah, because AA are actually, I mean, AS are healthy babies.
Okay.
They just will have to be sure what kind of choices they are making later in life,
Mm-hmm.
you know. But the only problem is if the baby turns out to be SS, I mean, a sickle cell
Yeah.
disease candidate, then of course the outcomes and the prospects, you know, and the life expectancy and the quality of life may be badly compromised.
Mm.
So if the child is AA, no problem, AS, no problem, SS, that's where the problem is.
Yes. But
Yeah.
how about someone coming in for a fertility treatment and
Mm.
the, let's say the woman, because it's the woman who's going to carry the pregnancy, yes? So if she's an SS carrier, if she has the sickle cell disease, how does that affect fertility? Or let me even throw that out for the men as well. Does it affect their fertility?
Affect men's fertility?
Both men and women, let's say.
Okay, let's take it this way. A sickle cell woman, the AS woman doesn't have problem with fertility because of sickle cell traits that she's carrying.
Mm-mm.
AS female would not have any problem with fertility
Fertility.
as a result of being AS. The
Mm-hmm.
same thing with the male partner.
Mm-hmm.
He doesn't have problem with his own fertility standing alone. You know, they live normal life, have normal kids if they make the right choices with the right match of genotype,
Yeah.
you know, no problems. The only people who have problems are the people who are frankly SS. Their reproductive potentials are usually compromised. Both
Oh.
male get compromised, the females get compromised.
Mm.
Because you see, I remember as gynecologists or obstetricians, you have a lot of problems in your hand dealing with a woman who is SS and pregnant.
Okay.
Yeah, because pregnancy, the pregnancy journey, antenatal period,
Mm-hmm.
for some of for a good number of them, it's usually not very peaceful.
I can imagine.
Yeah,
Yeah.
yes, they're battling with low level of blood. I mean,
Mm-hmm.
low blood volume (PCV). You know, stress during pregnancy can tip them into crisis.
Crisis.
The pain during labor can tip them into crisis. So they need a lot of pain management during labor,
Yeah.
epidural, if they are social enough to accept epidural intervention.
Mm-hmm.
Then delivery, for instance, is even another problem because their problems is even worse within the first 4 days of delivery.
Mm.
Yeah, they may have delivered the baby,
Yeah.
but yet they're not out of the woods because they could go into crisis even after
Mm.
delivery.
Okay.
Then breastfeeding may just not be straightforward because anything that stresses them predisposes them to having a crisis.
Mm.
So, and some have frequent crises even without pregnancy that
True.
as a man, I think you should be worried about making them pregnant.
True.
You understand?
Yeah.
Yeah, you should be worried about making them pregnant, because pregnancy for some of them may just be some life risk
True.
situation.
I have a friend who has sickle cell
Mhm,
disease, and any little, I won't say little thing, but for her it's
mhm.
very stressful, right? And she has
Yeah,
crisis so frequently, and it's just like, wow, you see these people going through so much
mm,
pain and so
mhm.
much, stress. You can't even think of adding any other kind of
It's stress to
stressor
them.
to them.
That's
Yeah,
true.
that's
That's true.
actually
Uh-huh.
very risky. So how important do you think genotype testing is
Oh
before
man,
marriage? I mean, we've spoken about that
it
already,
is
but
too important.
mm-hmm.
It's just too important. And for me, I think everybody should try to be very careful and take responsibility for all of this.
Yeah.
So I think, if I would have to make this advice for those in this region, or those who are disposed to having sickle cell trait,
Mm-hmm.
should have multiple genotype testing before getting into a meaningful relationship that would end up in conception and
Yeah.
childbirth.
Mm-hmm.
So I would rather say do this genotype testing like up to 4 times.
Yeah.
You understand? It's not costly to test for genotype. In
Mm-hmm.
in Nigerian laboratory, for instance, just about 1,000 or 2,000,
Okay.
3,000, and this is just like $1.
Fair. It's even up to $1 now.
Oh yeah, in some places it could be more than $1.
Yeah.
Yeah, in the public institution, it could be less than $1.
Mm-hmm.
Because it's a cheap test to do. So do it again and again and again. This the scenario I presented.
Yes.
A guy who did it 2 to 3 times before marrying,
Mm-hmm.
and the monk certified that he was okay to get married to his woman, who was already established AS,
Yes. Mm-hmm.
only for us to discover that in our own facility that he's
Mm.
AS. Already we're talking about doing IVF within the next few days,
Yeah.
and then he is AS,
So it's just.
and then it was devastating.
Mm-hmm.
It
Of
was so
course.
devastating that he said he can't tell his woman.
Oh.
That's true, because
Yeah.
he said she can't handle it.
Of course. I mean, that would be total
Because
heartbreaking
she had done
news.
her bits in
Mm-hmm.
making sure that she's making the right selection.
Yeah.
And then you thought you are the right selected guy.
And it's
And
just.
then we found that you're not
Yeah.
compatible. I mean, going given the situation you find yourself and the amounts of fund you have to do the fertility treatment,
Yeah.
you know. And then we requested for this test. Test was done 4 times. If each of those times this test was done in standard laboratories, they were AS. Talking with the guy, I felt very, very terrible myself.
I can't imagine.
See, how am I going to tell my wife?
Yeah.
We all thought I was AA,
Is it
and she
total
was the one that she is AS.
AS? Yeah.
You know, and now so the fertility prospect is on hold.
Mm-hmm.
And when I say, okay, there's another way. You could do an IVF with pre-implantation genetic diagnosis,
But the cost.
but the cost is huge.
Mm-hmm.
The cost is huge, and young guys may not be able to raise that amount of money.
Yeah.
And then because of his own fate, doing a gamete donation may not be
May
an
not.
option.
That's true. Mm-hmm.
Because one of them may opt to take a donated gamete
Mm-hmm.
from an AA individual, and then you avoid all of that. Then you can do the conventional IVF.
Yeah, but some faiths just
Some people don't like it,
don't
so you see,
even
it got even
want
more
that.
complicated.
Yeah.
So that's what I think.
So does that go into some of the genetic counseling that I'll say you do with your patients? I mean, encouraging these genotype testing
Mm.
before even going into something that you think would end up in conception. Do you do any sort of counseling, genetic counseling for your patients before you go ahead with IVF treatment?
So let me understand. When you say genetic counseling, what
That's, I mean,
exactly do you
other
mean?
than taking the test, other than having a genotype test done,
Mm.
let's say they already have that done,
Mhm.
and you'd want to talk to them about the prospects of the IVF, like you've mentioned,
Mm.
pre-implantation genetic testing. Do
Mhm.
you counsel your patients about that, and or should I say encourage for that to be done for the prospect of their pregnancy, the outcome, let me say, of that
Yeah,
pregnancy?
if if you're dealing with a couple, for instance, that you think could need some of those genetic counseling, of course, from their history and their age and the fertility care, you will be able to tell what kind of genetic counseling you are going to give to them.
Yeah.
So the common one we actually see is a sickle cell, and of course, you counsel them and give them all the options and make them make their decisions. Other genetic things you want to look at are for those who have had recurrent pregnancy losses or recurrent implantation failures,
Okay.
that you think is something genetic may be responsible for that. Then, of course, you want to do pre-implantation genetic testing too, so they will know. Then, for those who have had syndromic babies, the trisomies, monosomies, Down syndrome, Petal syndrome, and all of those syndromes,
Yeah.
you also want to be sure that this is actually going to be taken care of. So you can counsel genetically based on what you think these couples are predisposed to, and of course, based on their fertility history too. So yes, we do what we have to do it.
Okay. So can you explain a little bit more about how the pre-implantation genetic testing would prevent having a child that carries the sickle cell disease?
Okay, so how this work is this: you do the conventional IVF, and then you create embryos.
Okay.
When embryos are created, you take biopsy of the embryos. It's just like you're taking a skin snip of an adult, but you take a biopsy, the outer part of the embryos, and you do what we call like DNA amplification. So you're able to read the entire DNA
Okay.
or
Wow.
of the baby in that tiny primitive state,
Yeah.
and in that you'll be able to tell whether there are major genetic abnormalities and what the genotype, the gender of the baby is, and all of
That's
that.
interesting.
So you know all of those things, especially those you set out to look out for, and then you'll be able to tell whether this embryos is AS or this embryo is AA or SS and all of that. So what happened is that you just avoid the one that is SS, and then you only transfer into the woman the one that is AA or AS.
Okay.
So that way she can never
Yeah.
have an SS, because you know what the baby represents, the embryo represent before you
Yeah.
transfer into the woman.
Oh, that's
So it is what
interesting.
you transfer to the woman that she would have eventually. So that way you are avoiding SS.
Yeah.
So that's what happens.
Okay.
And that's how it's done. It's not
That's
as simple as I
actually
made it sound, but it's a very technical procedure.
Hmm.
But we do it as often as we find clients who are
Yeah.
willing to have it.
That actually sounds very interesting. I mean, you already have, how would I say, a positive outlook on, the outcome of the baby and their genotype and all those
And
things
the
when you
sex,
exactly the sex as well when you're
and the
going
degree of
into
normalcy
that.
of the embryos. We call that euploid.
Okay.
Yeah, when the embryo is normal, euploid, it means the embryo has a very good chance of becoming a baby.
Okay.
Yes, then you see embryos that are also very poor, aneuploidy, and then you can also avoid them because they can't become babies.
Oh,
Even if they do, maybe babies with syndromes.
I
Yeah, so you
see.
avoid
So you
all of
avoid all
those.
of those
So
things.
when you do genetic analysis in assisted reproduction technology, you are improving on the quality of a life. Yeah, so improving on the quality of a life, and you're helping nature to eradicate abnormal conditions.
Yeah. So we know about the cost challenges that we face in making this more affordable and accessible, especially with pre-implantation genetic testing. This actually altered the course of a couple's IVF treatment. They couldn't afford to do that. Is there any way to make that a bit more affordable and accessible, or is it just,
Yeah, if you're doing it under a trust, under an insurance,
okay?
then it could be a lot accessible or
Mm-hmm.
affordable.
Mm-hmm.
But then if you are in a situation like in West Africa, for instance, where most of these cares are offered under the private institutions,
Yeah.
then of course it's very difficult to affect the cost of this kind of intervention.
Mm-hmm.
So, and West Africa is not in that position at the moment.
To do
Well, even
that.
in the Western world, some other person may have to bear the cost
I can
of
imagine.
all of those, but
Mm-hmm.
then it may be a lot more accessible
Okay.
because insurance systems are very big and working over there.
Okay.
So, but
So
for here, I don't think there's a way to go around it.
yeah.
And also, our premium on fertility is very poor
Hmm.
in this part of the globe, and so I don't think the government is willing to
To
invest this amount
yeah,
of money.
actually.
And so, what we'd rather be talking about would be prevention,
Mm-hmm.
doing this test over and over again, the genotype testing,
Yeah.
and consciously making your decision on who to have kids with, and do what you have to do to have safe babies.
So at this point, prevention is better than
Oh,
cure.
yeah, that's what we should be talking about.
Yeah,
Yeah.
that's one of the most common sayings, but it really is important because this is another person you're bringing into the world, right?
Hmm.
You're responsible for this person, so you should be making those informed decisions before you go ahead with any sort of relationship or you know any sort of marriage, anything that is going to lead to you bringing children into
Hmm.
the world. So we have, when I said I have a friend that is a sickle cell disease patient, she actually goes into crisis a lot and it's painful, right? At this point, I think she might be tolerant to a lot of pain
Oh, yeah.
medications.
Addiction to
Yeah,
medication is a
exactly.
problem here.
Yes. So, um, how are the management how is the management of this pain done? How should I say, how can it be made better? Because if they have these painkillers every single time they go into crisis and they build this tolerance, is there any way to make a change in that?
Oh, well, in as much as I'm not a pain specialist,
Yeah, just
you
a little
know,
bit of your opinion on that.
well, I think they should avoid whatever give them crisis.
Mm-hmm.
That's what I would say for now. And medication should be given under controlled environment,
Okay.
and they shouldn't be given unnecessary access to all this medication because they may just get addicted, and then it would be a problem on top of the sickle cell they are having. Because drug addiction and management
Mm-hmm.
can be a very big social and medical challenge to
True.
such individuals. So back to the word prevention, you can't
Basically.
overemphasize that.
Mm-hmm.
Yes, you can't overemphasize the word prevention and making the right choices.
Okay, so we have, like I said, our community,
Mhm.
asking questions back at us, especially since you spoke about CRISPR. You're wondering, is CRISPR the cure to sickle cell disease, or can it truly cure sickle cell
And
disease?
by the way, I think on my TikTok page,
Mm-hmm.
some people actually thought we have the cure for
Yeah.
CRISPR, but we do not have the cure right here in our facility.
Mm-hmm.
It's not even in Nigeria. It's not in Western. It's not in Africa.
Wow.
Oh, yeah, it's not in Africa at all. We're just bringing awareness or creating awareness that there is a cure currently,
Mm-hmm.
but erroneously, yeah, it's not with us. The cure is not with us. It's with the
Mm-hmm.
Westerners. I mean, it's with the West. So CRISPR is available. We do not treat people using CRISPR in this part of the world.
Yeah.
You could have CRISPR in the United States. You could have CRISPR in England. Currently, that's where CRISPR
CRISPR is
it's
done.
being administered, used.
Okay.
And by the way, that is the only cure for sickle cell currently as we speak.
Hmm. Interesting. So
Yeah,
it does cure
yeah,
sickle
it cures
cells.
sickle cell.
Okay.
That's the only cure for sickle cell as we speak right now.
Mm-hmm.
And it's good to know that it's a gene editing kind of therapy. I know sickle cell is a genetic disease,
Yes.
when there's an abnormality with some of the proteins in the gene, in the DNA.
Mm-hmm.
So what CRISPR does is that CRISPR cuts off those abnormality and realign the genes to be normal.
Yeah.
So that's what CRISPR does.
Mm-hmm.
So, and the treatment goes this way: you get the stem cells of this individual and edit the stem cells using CRISPR,
Okay.
because the stem cells are abnormal, but you edit them using CRISPR. I know life is very interesting now that a lot of things about our lives, about our looks, behaviors, attributes can be
Edited.
edited.
Mm-hmm.
Yes. The way we look,
Mm-hmm.
how tall we become, how muscular we become, how beautiful we
Basically
look,
everything.
how intelligent we are can
Yeah.
all be edited. And that's the truth.
Mm-hmm.
So, but now we're just looking at this disease condition. So you get the stem cells of this individual in the lab, you edit these stem cells and make it normal.
Okay.
And now stem cells are part of us that grow into what we are.
Mm-hmm.
Each of the organs are controlled by some stem cells. So in this case now, the hematological stem cells, the hemopoietic stem cells, are edited using CRISPR, and then they are infused into the human body.
Okay.
And now that takes over the entire blood system
Hmm.
and grows healthy blood with the fetal hemoglobin again,
Oh,
and
wow.
take out all the sickling, and then you get cured. So a lot of people, so far about 12 people have been cured, I think, in the United States using CRISPR.
Okay.
Yes. And then
It's
in the
quite a
United
number.
Kingdom, uh, you could access the care under the private care or under the insurance, the NHS.
Hmm. I know they have
Then
that.
the cost is a little lesser under the NHS, but of course, someone is paying for it.
Of course, yeah.
Then under the private, the cost is a little higher.
Hmm.
And the cost is about $2.2 million.
Ooh.
Yes, $2.2 million
Uh-huh.
in the United States. Then in England, it's about 1.67 million
Oh,
pounds.
that's a
Go do the
lot.
mathematics
Yeah.
and know the problems you cause for yourself when you have a sickle cell baby.
Yeah.
That's the cause. So
That
I
is.
don't think people around this part of the globe can easily access
Mm-mm.
or have the funds to go in for this kind of treatment.
Yeah.
But it is a game changing treatment for sickle cell.
Definitely. It does sound like it.
Yes, and it's been made possible by CRISPR gene editing technology, and
Mm.
people are accessing it right now.
Yeah, I mean, I wonder how long that's going to take to come down here because
Mm.
there's so many advancements in, medicine and science that's being
Mhm.
made in the Western world.
Mhm.
And before it reaches
And by the way, let
this
me just
side,
cut it short.
yeah, go ahead.
Down syndrome is also a genetic abnormality.
Hmm.
It's also been cured with CRISPR.
No
Oh,
way.
yes.
Okay,
It's
that's
also cured with
interesting.
CRISPR. There is a recent publication from Japan
Hmm.
where CRISPR was used to cure an individual with Down syndrome.
Oh, so it's more than just the
Mhm.
sickle
So
cell. It's
exactly, just for a lot of things.
hmm
We have a lot of cystic fibrosis, for instance, Hodgkin's disease. This
yes.
and some habitual blindness,
Mm.
have been cured using. I mean, genetic blindness, congenital blindness, have been
Hmm.
cured using CRISPR gene editing technology. So it's just not sickle cell. Sickle cell is just one of it.
Yeah.
Yeah, we're just talking about it because we are plagued by it. We are endemic. We are
Hmm.
the epicenter in the world.
True, we are.
Yeah,
Yeah.
so that's the cost. 1.67 million
Pounds.
pounds or $2.2 million.
That is expensive.
So that's quite huge.
Yeah,
That's a cost.
it
So when you make
is.
such mistake and you deceive a woman, or a woman deceives a man
Man.
into
Hmm.
marrying, and you have a sickle cell baby, you
That's just
know,
what you're
that's
incurring.
just
Hmm.
what you're looking at to get a cure for it. Because before now we have the bone marrow transplant, but it doesn't cure it.
Hmm.
It just improves your life quality,
True.
reduce your frequency of having of crisis,
Yeah.
and improve your life expectancy. But it's not a
It
cure.
doesn't care.
Yeah,
Mm.
but CRISPR edits your gene, change the genes, correct the gene.
So
Oh
interesting.
man.
It's so interesting. I wish I could do CRISPR. But yes, that's actually one of the questions we
Yes, and
got.
then it's from age 12 and above.
Okay,
Yeah, yeah,
wow.
age 12 and above. It's good to
That's
mention that.
actually not a
Age
bad
12 and
range.
above.
Yeah,
Yeah.
it's interesting. It's actually one of the questions we got from our community from all of our platforms.
Mhm.
Explain to help explain how this CRISPR works, which you've already done, and how
Mhm.
expensive it is. So if you ask this question, this is
It's
the
not like
price.
it's not like 2.2 million naira.
No,
We'll have asked the government of Nigeria
to just
just go
put
and
something into
do
that.
something
Yeah.
about it because we're epicenter. But
Mm-hmm.
this is $2.2 million.
Yeah,
Man, I don't
it's
even know how much that
it's
translates to
really
in
not
naira.
accessible to West Africa, Africa in itself, because
Exactly.
what?
But this
That's
is
a
what I
lot.
think the government would do.
Mm-hmm.
Well, I'm a CRISPR advocate,
Yeah.
and I think in Nigeria, I may be wrong, but I think I am the first to talk about CRISPR in Nigeria. I have
Mm-hmm.
given lecture on
I can
CRISPR
say so.
in the University of Jos, like about 8 years ago now,
Oh wow.
and counting.
Yeah.
Which I would think would be the one of the first lecture in a public institution that has to do with CRISPR.
Mm-hmm.
And I know that yearly we have our CRISPR convention, and depending on which region of the world is going to hold in October 20, actually, is actually the World CRISPR Day.
Okay.
And it's not just for sickle cell, it's for all diseases. Like three
Yeah.
years ago, One of the major diseases we talked about in the CRISPR meeting, which was in the, I think, United Kingdom, was sickle cell. Imagine United Kingdom talking about sickle cell,
Yeah.
and Nigeria was not
It's not.
represented in it.
Oh,
So I think if this is important, which of course I know it
it
is,
is.
and it's an issue of public health importance,
Yeah.
there may have to be a collaboration between the federal government of Nigeria and the company are dealing with this kind of CRISPR issue, so there could be some bilateral relationship to help the public in Nigeria.
That's
Because
actually.
if you go to sickle cell clinic in Nigeria, for instance, you just be amazed at what you see.
Yeah.
Yeah, you
Can
just be amazed at what you see. You know, it's very painful. The sickle cell child who died not too long, a big boy, and why people were talking about his stories, they said that he had already told them that, why are you people making me trying to do normal right things while I know that I would die not too
Yeah.
distant time.
You can imagine
So
a
that
child
kind of
having
touchy
that thought.
statement,
Yeah.
you know,
You can imagine. That's
yeah,
really sad,
yeah.
actually.
And there's a sickle cell baby I saw about 7 years old. She asked her mom, how come I'm different from all other siblings that I have? I'm always in the hospital, I'm always sick,
Yeah.
you know.
They don't really understand this.
Yeah,
Yeah.
you
They
know.
don't really
So it's
understand this.
painful.
So
So I
it's
think the for now as it is, it has to be a
prevention.
government thing. Prevention is all right to
Yeah.
do. Yeah.
At
And that is
least.
why testing should be done precisely, should be done multiple times, and don't take one result for a final answer.
Yeah.
Do it over and over and over again. Yes, and be sure before you make a move, because having one child with sickle cell, it's it's going to be a big burden to any
So
family.
yeah, the whole family actually, whether it's just the parents and like you said, the 7-year-old who has other siblings, the other siblings too might have a little bit, especially emotionally, trying
Yeah.
to be there for your sibling that has sickle cell. So I have one more question before we go. It's someone asked, is it true that the CRISPR also stops birth in patients who it was used on? So like I
That's
said,
false.
that's false,
That's
right?
completely false. CRISPR can be used for anything. If you want to use CRISPR to stop birth, you can use it to stop birth because it can edit anything you want
Yeah.
it to edit.
Yeah.
You can even use it to edit aging.
Wow.
Oh, yes. You can use it to edit
We're teetering
aging.
close to that sci-fi level of
Well, that's true. Because the world
technology.
is actually thinking about that. Humans have actually have the feeling and the desire of immortality.
Yeah.
And that is why you see, if you're a religious person, for instance, you go to Christianity, in Christianity, you'll be told that you're going to live eternally. Yes, in heaven. Even in Islam, they were told they're going to have eternal life.
Yeah.
Also in Al Jannah or
Yeah.
somewhere, I don't know if I'm
Al
saying the right
Jannah,
thing
yeah.
now, but I translate that to be heaven. You know, and if you look at other religion, the Buddhists, the Hindus, and all of that, they feel there is a place you will go to when you live a good life. So this means there is kind of life after
Afterlife.
life. All right. So the living eternally has been in the human subconsciousness. So, but science is bringing it so close by working so hard on the science of aging.
Yeah.
Call it anti-aging, call it eternal youth, and then we're looking at the near future, probably 2045, where aging will be classified as a disease, and then people will have the ability to live forever again.
It's
Yes.
crazy.
So you may see it as being very cheeky or very mundane, but you see, there's nothing good about aging. There is no single good thing about aging.
It comes with a lot of complications.
Yeah.
Yeah. Yeah, it
If
does.
you want to see what aging means, go to old people's homes, and then see what aging is: arthritis, heart failure, hypertension, dementia. Is it dementia or dementia? It's called dementia.
Dementia.
And all the problems: heart failures,
Yeah.
bone crisis, osteoporosis, menopause for women, and the things that follow after menopause. That's what aging.
It's
Aging
just a
comes with a
lot.
lot of
Yeah,
problems,
it
and
does.
then a lot of diseases are associated with aging: hypertension, diabetes, arthritis, blindness, or poor sight, poor vision, no
Yeah.
teeth. You can't eat your favorite food anymore. These are all age related. But if you have the ability to be young forever, or for a long time. So it means these disease conditions would be stored for that length of time. Diseases that are
Yes.
related to aging. So it's
Yes.
not just about being funky, being youthful, but being healthy. And at that
Intact.
point, a lot of disease would have met with their cure,
Mm-hmm.
because most diseases are related to, I mean, good number of diseases are related to aging. So CRISPR can do all of that. So we're just talking about what sounds sane right
Yeah.
now: Hutchinson's disease,
Yeah.
sickle cell,
Mm-hmm.
and all of that. Intelligence can be changed up to the age of 13 with CRISPR.
It's
But the question
interesting.
is, who defines what level of intelligence it is?
Exactly.
And I think this is actually the time where the world leaders would also have to sit together and put boundaries in
On
places,
this.
because life is just like an open system.
Mm-hmm.
You can now edit it. But just like a month or two ago,
Mm-hmm.
scientists from Cambridge, it was on BBC, that they have understood the genome of man. Although genome of man has been understood long time ago,
Mm-hmm.
you know, they say they can even make life without requiring human beings.
Wow.
So what we're
That's
talking about, these
very
are all possibilities.
advanced.
But
Yeah.
CRISPR is here. It's already been deployed.
Mm-hmm.
The same CRISPR, some babies were used on some embryos, and the babies are supposed to be immune from HIV, because they use a CRISPR to change the CD4 receptors.
The
And so HIV has no
effect on them
receptors
at
to
all.
bind
Yeah, to
to. So they
bind.
can't be infected with HIV.
Oh,
Tell me, this
you
is
can imagine.
superhuman.
Yes, at this
This is what
point.
we call, in biology, sorry, you're distracting me. In biology, when I was in biology class,
Mm-hmm.
we have the Homo habilis, Homo erectus.
Mm-hmm.
We are supposed to be Homo sapiens.
Yeah.
Then now we're getting into the generation of Homo deus, humans with extra abilities,
Yeah.
and it's gene editing.
I mean, it is a superpower at this point.
So, so CRISPR does all of this. So it does Down syndrome, Huntington's disease, cystic fibrosis, sickle cell, which is African
Basically,
problem.
yeah.
You can use it to change the way a woman
Anything
looks.
gene related, I
Yeah,
would say.
anything gene related you
Mm-hmm.
could do with CRISPR,
So,
because every character
mm-hmm.
that we express is coded in a
No
gene,
gene, yeah.
and then you can change the gene to what you want it
Mm-hmm.
to be.
Yeah.
And that's the beauty of
It
life.
actually is
So life
beautiful.
is just about to start, actually.
I mean, I didn't know that much about CRISPR, and to be honest, like I said, it sounds a lot like one of those sci-fi movies that everything is about to change. But I want to know: is there going to be side effects to that? Because you say anything for everything there is pros and cons. Do we have any side effects that you know of for CRISPR at this point?
Oh, well, if I can't sit here and say there can't be any side effect, but I'm tempted to say so.
Mm-hmm.
Yes, because you cure a baby of sickle cell using CRISPR. Where is the side effect?
Yeah.
You've just taken out punishment from this individual. You cure an individual of Down syndrome using CRISPR gene editing technology. Where is the
Mm-hmm.
side effect? But the issue is that CRISPR can be used for evil.
True.
Yes, you can use CRISPR in development of arms, ammunitions
Mm.
that can wipe a generation. As much, it can cause gene modification and mutation
Mm.
if it's used in arms and all of that. So that's an aspect. But I dare say that at this point, everything has side effects.
Okay.
You could take a car for a trip and you go safely. You could use the same car and you have a
You have an
crash.
accident. Yeah.
When plane crash, nobody survives. That's side
Mhm.
effect. But of course, within minutes or hours, you got into your place of destination.
Mhm.
So yeah, but CRISPR is just a blessing. Yeah. So if you ask me again whether it causes side effects or has side effects,
You'd say
I would rather say no.
no.
When we argue in Europe, for instance, I have my friends in Europe who talk about CRISPR gene editing, and they say, yeah, no, how about when you change these characteristics and then it affects some other part of the body? It's all speculative side effects and not sincere or encountered side effect.
Mm.
For instance, there's a gene for eyelash. Sorry, I may not be very correct. I don't know what it's called. I think eyelash.
Eyelashes.
Women have double eyelash. Do you know that?
Eyelashes or
So
eyelids?
this is eyebrow,
Mm-hmm.
right?
This is the lead.
This is the
And then
lid.
you're talking about this one.
What did women add to this and makes it
Oh, okay, yeah.
double.
Oh, the lashes.
The
Yeah,
lashes.
extensions. Okay. When you say double, that kind of had
Yes,
me taken
when you
aback.
add it, it makes it bigger, right?
Yeah, yeah.
And that's fashionable.
Hmm.
But there's a gene for that. So if a woman wants to be naturally fashionable, she
She
could
can
have a
actually
gene
edit
editing
it.
with for that gene, and she
Mm-hmm.
had natural double eyelash,
Mm-hmm.
and then she doesn't need to be attaching it because I think attaching it is using glue or something.
Yes,
I
yes.
don't know if the glue touches the eyeball sometimes.
Sometimes
Sometimes
the
it does.
fumes of the glues can actually make your eyes irritated and all that.
So you
So
see,
yeah.
so every of these characters
Mm-hmm.
have gene representative,
Okay,
so you
that's
can
interesting.
practically recreate the
Mm-hmm.
look of an individual. Intelligence, beauty has a gene,
Mm-hmm.
and all of that. And even criminality has
Oh, okay,
genes.
okay. Let's not go into all of that
And
right
I
now.
can be sure that we have so much of it in this part of the world.
Oh, please.
So
So
yeah,
yeah.
all the character you see,
Mm-hmm.
up to the point, the way an individual walks
Yeah.
could be genetic.
It's change. Okay, well,
Yeah.
thank you so much for that. That
So
was
before we finish,
uh-huh.
prevention of sickle cell. Sorry,
Yeah.
um, some people will have to do what we call a chorionic villi sampling, because I remember in my TikTok video, it asks
Mm-hmm.
about chorionic villi sampling.
Okay.
Chorionic villi sampling is invasive because you have to take a blood sample from the placenta or from the cord of the baby and do
Mm-hmm.
a DNA, I mean a genotyping,
Mm-hmm.
or even amniotic fluid, amniocentesis and the genotyping, to see what the genotype of the baby you're carrying. But then, if it turns out to be SS, what do you do with
There's
the
nothing.
baby?
Yeah.
Sometimes these guys do it so they could just terminate the pregnancy.
Mm.
And then terminating pregnancy at 10 to 14 weeks, for instance, it's not usually a very comfortable place to be. But then, and then also, what is the moral,
Implication.
your
Yeah.
moral, I don't know, what's the morality for doing that at
Yeah.
that stage? So
Yeah.
I feel still screening tests to be sure of what your genotype is and all that. But of course, if you think you have to terminate and it's a good reason, that's your business anyway. You understand? But some people do that. So the key again is, how many more would you
Would you
terminate before you
do?
have the right one?
Yeah, because you already carry that gene. So
Exactly. So, and termination may come with its complication too. And the testing itself may come with its own complication. So those are some things you could do to avoid sickle cell. Testing when pregnant, then decide what to do with the pregnancy, and testing before getting into a childbearing relation. Then, of course, when you both decide, of course, you go for pre-implantation genetic diagnosis. I've seen couples who are sure they are both AS and they really to get married and they have the phone, and we have done IVF for them, their babies. And the good thing is that with that pre-implantation genetic diagnosis, you could have multiple babies, and then you could have some of them frozen or cryopreserved
mm-hmm.
that would be used by you some other time later
Yeah.
in life, and you don't have to pay that huge sum of money
To do it
to do the
again.
gene analysis again. you know
Okay. Well,
so
that's
let's not
cool.
end today's
Yeah,
talk.
there isn't actually, but we have to we have to stop here for today. And like you said, cryopreservation, we've spoken about that. Like I always say, you can go back on all our platforms, all our videos, all our live sessions are post recorded. Go back and look through them. That's where we get these questions from, because you throw in these questions at every platform that we talk about these topics. So let's say thank you so much again, Dr. Ken, for being here with us.
My pleasure.
CRISPR is a very interesting topic. I mean, if you could be on this other side of the camera, you'd see my eyes going wide every time you say something. So yeah, that's you know, like you said, it's the only cure for sickle cell disease at this point in time, at the moment, and it's very expensive. About the cost, this is the cost: 1.67 million pounds in the US and 2.2 million dollars in the UK, sorry, and 2.2 million dollars in the US. So this is the cost around that. So prevention is way better than cure for us right now, because CRISPR is probably not coming to Africa or West Africa anytime soon. So but we're hopeful that the more we raise awareness around this topic, we'll have better better chances of having CRISPR coming down to us over here. So thank you very much for sticking with us once again. It was lovely to be here. We will see you next time to go on all our other platforms: Facebook, Instagram, TikTok, YouTube, we're everywhere. So please go on there and make sure you subscribe and turn on your notifications just so you're notified the next time we have another show. Thank you so much for joining us. See you next time. Bye.